So today we're going to talk about why blacks have a higher risk of diabetes and high blood pressure. There's a great article, I'm going to put it down below, by John Hopkins that talks about having low potassium and then increasing your risk for diabetes, and then having higher amounts of potassium and decreasing your risk for diabetes. But there's this huge focus on reducing sodium, right? Like cut your salt down if you have high blood pressure, for example. But what about increasing your potassium? That's completely ignored. Our bodies actually require 1,000 milligrams of sodium every single day. That's almost one level teaspoon of salt will give you 1,000 milligrams of sodium. But when we talk about potassium, it's more than 4 times. We need 4,700 milligrams of potassium, but we only need 1,000 milligrams of sodium. Okay, so the ratios are basically 4 to 1. And very few people have this correct ratio. And those people with diabetes and high blood pressure, they're lucky if they have half the amount of potassium. But they do have a lot of sodium too, hidden sodium from junk foods, monosodium glutamate, things like that. Not to mention, if you have high blood pressure, you're usually taking a diuretic, right? Thiazide. Well, guess what? That alone will deplete your potassium. High carbohydrate diets deplete your potassium. So serum potassium or blood potassium is an independent risk factor for diabetes. So now let's just talk about what potassium does in the body. It does a lot of things. It helps you store glycogen. So here are the glucose molecules. They're combined and stored as stored sugar, it's called glycogen, with potassium. So if we're potassium deficient, we cannot store glycogen like we should. And then we're going to crave sugar, right? We're going to crave sugar, and we're going to have blood sugar swings up and down. And also it's going to worsen insulin resistance, which is always involved in diabetes. And when you have insulin resistance, your body makes more insulin, but it doesn't work. So the blood sugars start going higher and higher and higher. So when you lower your potassium, your blood sugars go up. Your arteries actually stiffen up when you don't have enough potassium, and that's why the blood pressure goes up. So taking more potassium can make your blood vessels very elastic. Potassium actually protects the kidney. Now, when you have end-stage kidney disease, they don't want you to take potassium because it can be toxic. But if you don't have end-stage kidney disease, you need potassium to protect it. And potassium can also decrease the risk for gout, which is usually pain in the big toe, and it's a form of arthritis. But I think most people don't realize what this means, like 4,700 milligrams. Do I have to eat 10 bananas? No, because that's too sweet, because we want to go on a low-carb diet. For those of you that are new, I put a link down below of exactly what diet you need to do to actually fulfill your potassium and lower your carbs. Okay, it's a link right down below. But the most important thing is to make sure that you consume foods with enough potassium. What will help is to increase your salads. Okay, very simple. Have 2 salads. And at the end of the day, if you can achieve between 7 and 10 cups, that will get you a lot closer to this. Of course, you're going to get potassium in other foods as well, but this is the easiest way to do it. A couple big salads, and you will be shocked to find out what happens to your blood pressure and your blood glucose levels. One point about this that's interesting, when you buy a supplement, you can't find one higher than 99 milligrams. That's weird, isn't it? But we need 4,700 milligrams. So I highly recommend start with your diet, okay? Cut the carbs down, increasing the foods with potassium, and just see for yourself the benefits. Not just blood sugars and cravings, but blood pressure as well. All right, thanks for watching. Hey guys, real quick, I have a new healthy keto eating plan for you. Just go to drberg.com. It's right on the front page. I put a link down below. Download it. It's free. Check it out.